Are you thinking about becoming a parent? Preparing your body for pregnancy is one of the most important things you need to do in order to ensure a smooth and healthy journey. In this video, we're going to go over everything you need to know in order to get pregnant quick and prepare your body for pregnancy. So please stay tuned. Hi my people, welcome back to my channel. My name is Midwife Jess, and today I'm going to take you through the steps you need in order to get pregnant quick, okay, and also to prepare your body for pregnancy. The first thing we're going to discuss about is preconception check. If you've watched my previous video, I talked about health assessments. Preconception check is more like health assessment, okay? But today I'm going to explain it step by step what happens during preconception check, okay? So preconception check is when you and your partner visit your healthcare provider, and what you're going to do is that they will do some assessments on you, take some blood tests, and take some histories from you and your partner, okay? Some of the histories that they will take is your medical history. They want to know if you have any health condition in the past and present, okay? They will also take your family medical history. They want to know if there's any genetic disorder that runs in your family, any health conditions that run in your family. And then they will also take your reproductive history for the woman. They want to know if you've been pregnant before, what happened during those pregnancies, or if you've not been pregnant before. They want to take your ovulation history. They want to take your menstrual history. They want to know if you've had miscarriages before or if you've had abortions before. And then next, they want to know your social life or lifestyle. They want to know if you smoke, if you drink alcohol, or if you use drugs. Also, your exercise habit. They want to know all these things, okay? And then the next thing they will do is physical examination. They will take your height and your weight. This will help to know your BMI. This is because being underweight or overweight can lead to a lot of complications, okay? It can even lead to you having difficulty conceiving. So they want to ensure that you're maintaining a healthy weight before you start trying to conceive, okay? Then after that is done, they are going to take some blood tests on you, okay? They will take your blood sample and they are going to do some tests on you. Some of the tests they are going to do is your blood type and resource factor, okay? Sure, I know some of you do not know your blood type, but this is an opportunity for you to know your blood type, okay? Or your blood group. So this is also important because if there's an emergency and you would need blood transfusion, they can easily go and get a blood that will match your own blood type and transfuse you, okay? So that's why they do this blood test on you. And then they will also want to check your thyroid function, okay? So they will do some blood tests to check if you have any thyroid disorder, which could be hypothyroidism, hyperthyroidism. They want to know. They will do full blood count on you to know if you have anemia. They will also do diabetes screening on you just to check if you have diabetes, okay? So they will do all these blood tests on you. And another test that they will do on you is to check for any infectious diseases that you might have, such as hepatitis B or C, or HIV or AIDS, okay? They want to do all this screening. They want to screen you for sexually transmitted infections such as gonorrhea and syphilis, okay? And when that is done, they will do genetic testing for you. Genetic testing is to check if you have any inherited genetic disorder or genetic condition such as cystic fibrosis or sickle cell anemia. They want to know all these things. They will also do hormonal testing on you. This is to know for the woman if she ovulates at all. Some women cannot even tell if they ovulate or they do not ovulate because they cannot really tell, okay? So they will do this test on you to see if you ovulate. And then for the man, they will check your testosterone level, okay? So this is very, very important. And then they will do immunity and vaccination testing for you. This is to know if you have any disease already in your immune system, such as measles or chickenpox, okay? And that reminds me, please, if you're planning to get pregnant soon or you're already pregnant, please ensure that you're up to date with your vaccination, okay? Please take your rubella vaccine, take your flu vaccine, take your chickenpox vaccine. This is because once you're pregnant, your immune system is compromised and you can easily be infected. So please ensure that you're up to date with your vaccinations so that you won't be infected with all these diseases when you come in contact with them. Okay, it's very important. Fine. Then the next test that they will do on you is fertility assessment, and this is the most important one for most people. Not everyone, for most people this is the most important one. So your fertility assessment. So with fertility assessment, for the woman, they will assess to see your ovary reserve and your uterine health. Uterine, some people call it womb. So they want to know your uterine health. Your uterine is where your baby grows, so they want to know the state of your womb. Okay, and for the man, they will check you, they will analyze your semen. Okay, they will want to know your sperm count and motility. You know, for sperm to be able to fertilize an egg, it has to have all these features. Okay, the sperm count, the motility, especially the motility, the ability of the sperm to move, to swim and go and fertilize an egg. This feature is very, very important for a sperm to have. Okay, so if they will check if there's any issue, they will now know what to do at this point. Okay, then the final one is psychological and mental health. Your psychological and mental health. Okay, so they will ask you questions whether you've been depressed before, if you have any history of depression, anxiety, stress. This is because all these things can affect your fertility. They can delay you conceiving, so they want to know the state of your mind. Okay, fine. And one last tip I want to give to you, if you're still watching up to this stage, please, if you're finding it difficult to conceive or you're not about to start trying to conceive, please ensure to take folic acid at least 3 months before you start trying. This is very, very important. Okay, 3 months before you start trying is very, very important. Okay, this will boost your fertility. Okay, my people, thank you so much for watching. And the next one, we're going to discuss about tracking your ovulation or tracking your menstrual cycle. This will help you know your most fertile days, okay, in order to help you to conceive very fast. Okay, so please subscribe to my channel so that when I upload my next video, you'll be the first person to receive it. Okay, thank you for watching and have a nice time. Bye.